Good evening, guys. This is again Dr. Narayani from School of Health Sciences. I hope everyone will be fine today. Okay. By the continuation of neoplastia, genetics and inflammation from Unit 1 Pathology, which is from Biomedical Sciences, I'm going to teach you today about healing, regeneration and repair. And the next topic is hemodynamic, thrombosis and shock. Let us see one by one. Next. First one is healing. What is meant by healing? The process of restoration of health from an unbalanced, diseased, damaged or unvitalized organism, or even you can say unbalanced, diseased, damaged tissue or organ or parts of the body. If your tissue, if your skin, or if any organ gets injured, this injury can be restored. That is called as what? Healing. With this physical damage, healing involves the repair of leaking tissues, organs, and the biological system, what I said earlier. You see, for example, if we cut our hand or cut our finger with a knife, suppose, unknowingly if it happens, what we will go for? We will go for taking medicine, or we will go for doing first aid. What happens if we take medicine within 2 days or 3 days? The place where it is injured, it starts to get good tissue, starts to form a new tissue. So when we take medicine, it includes the process by which the cells in the body regenerate and repair to reduce the size of damaged or necrotic area. What is meant by necrotic area? Damaged, or you can say injured area, and replace it with new living tissue. This is called as what? Healing. So for injury, you are taking medicines to heal the particular injury. Next, this replacement or this injury treatment can be done by 2 ways, or the replacement can happen by 2 ways. What all are the 2 ways? Number 1 is regeneration. Regeneration is what? The necrotic cells are replaced by new cells that form same tissue as was originally there. The next replacement is repair. The injury gets repaired, or the injured tissue is replaced with scar tissue. Maybe in some organism, this both regeneration and repair will heal the injury. Next, you can see the picture here. I told that the replacement of injury can happen by 2 ways. One is regeneration and the second one is repair. You can observe the first picture. It explains the regeneration of tail in lizard. In the first picture, first section, the lizard have a tail. It is suppose if we see the lizard, we go for kill that lizard, is it? What happens? It starts to escape from us. During that time, it loses its tail. That is what second session it shows. Third session it shows, after 4 weeks, it starts to regrow. Fourth session shows that there is a regrown of tail after 22 weeks. This is what? Regeneration of injured tissue, which was originally there. Then second picture shows repairing. The replacement of injury happens by repairing the tissue. You can see there are two sessions. First session, there is a injury, there is a cut in the hand. The second session, second hand shows that scare. Scare means new cells, new tissue formed, and there is a mark, and there is a mark in which injury was upward. So these all are the two ways to replacement of injury. Next. Next topic is hemodynamics. Hemo, what is meant by hemo? Blood. The name itself shows that hemo means blood, dynamic means flow or force. So what is meant by hemodynamics is relating to the flow of blood within the organs and the tissues of the body. You know, our body have the circulatory system. That is blood vessels. Through blood vessels, blood is flowing throughout the body. If suppose there is a block, then it will result in various diseases. But that's what explained by hemodynamics. It is used to describe the intravascular pressure and flow that occurs when the heart muscle contracts and pumps blood throughout the body. Everyone knows that blood enters into the heart muscle, the heart, and through arteries, it comes out and pumps blood throughout the body. The figure shows that there are two blood vessels. Upper one is normal blood vessel. There, the force enter into the blood vessel and comes as normal without any pressure. But in the second picture, you can see that blood vessel is getting narrow so that the blood is coming out with high pressure. That's what it results in maybe severe diseases. Next, what happens during this blood flow in our body? You see, we are the medicine students, so we should know about ourselves fully. That's what you are studying various courses, various modules related with medicine. What happens when there is a blood flow in our body? This blood flow helps in the transportation of nutrients required by our body, hormones, metabolic waste products, oxygen, carbon dioxide throughout the body to maintain cell level metabolism. Then it helps in the regulation of pH, osmotic pressure, and temperature of the whole body, and the protection from microbial and mechanical harm. Excuse me guys, there is a disturbance from someone. I think it is Rachel Nyamboji. Could you please mute your mic? Madam Rachel, please mute your mic.
Rachel, mute your mic. Okay.
The study of the blood flow is called hemodynamics. So you see, I already explained the heading. Hemodynamics. Hemo means blood. Dynamics means force or flow. So the study of the blood flow is called hemodynamics, where the study of the properties of the blood flow is called hemerology. Next. How can we monitor this high hemodynamic? Number one, we can measure the pressure, flow, and oxygenation of blood within the cardiovascular system, or using invasive technology to provide quantitative information about vascular capacity, blood volume, pump effectiveness, and tissue perfusion. By scanning, we can monitor this at all. Or measurement and interpretation of biological systems that describes the performance of cardiovascular system. Or you can simply say how we can monitor this hemodynamics means by means of checking heart rate, by means of checking blood pressure, or yeah, it includes by checking stroke volume, cardiac output, that is how many times our heart is getting beaten. So by shortly we can say we can monitor this hemodynamic by two methods. One is by measuring heart rate and another one is by measuring blood pressure. Next. Next heading is thrombosis. Thrombosis, we have studied about our blood cells. I hope everyone has studied about our blood cells. We have red blood cells, white blood cells, platelets. Platelets is thrombocyte. It is also called as thrombocyte. Is it? Yeah. If there is a problem in clotting or if there is a problem in platelets, it results in thrombosis, or we can say the simple definition as thrombosis is the formation of a blood clot known as thrombus. How it happens, how this blood clot happens? Because of the reduction of number in platelets. So this thrombosis occurs within a blood vessels. It prevents blood from flowing normally through the circulatory system. Circulatory system is blood vessel. We can observe the picture there. It shows a deep vein thrombosis in the leg. There is a sudden thrombosis. Even we may experience during playing like football, volleyball, during outdoor games, we may experience this thrombosis, sudden attack, a sudden immediate blood clot in our leg. Next, what are the symptoms of this thrombosis? Thrombosis occurs when blood clots block veins or arteries. Symptoms include pain and swelling in one leg, or sometimes we may experience chest pain or numbness on one side of the body. For example, our left side part totally, like left leg and left hand, both may feel without. I mean, it is not working. It is there, but without any work. You may feel like that. Complications of thrombosis can be life-threatening, such as stroke or heart attack. If we didn't treat this thrombosis, it may result in life-threatening, like stroke or heart attack. What are the causes of this thrombosis? I have mentioned some causes here. Number one, age. 60 age person cannot run like a 20 years person. Is it? 20 age person. So the age is also one of the cause for thrombosis. Sitting for long periods. That's why our doctors will advise sometimes that if we are working sitting position for many more times, then they will advise us to do some exercise, simple exercise, like we want to turn over our neck 10 times. We want to push our hands and legs, and we want to stand at least or walk at least 2 to 3 times. Why they are saying like this? Because it may result in blood clot or thrombosis. Then bed rest, like when you are in the hospital for a long time, can also keep your muscles still and raise your odds of DBT. That's what thrombosis. Then pregnancy time, obesity, that means you are so fat. Serious health issues, certain inherited blood disorders. Then injury to vein. If suppose there is an injury maybe by knife or maybe by stone, if during our playing, when we play in the ground, so there is more chance to occur injury in our leg or in our vein. So these are the causes of thrombosis. Next, diagnosis. How can we diagnose this thrombosis? I told that hemodynamic can be diagnosed by checking heart rate and blood pressure, right? How can this thrombosis can be diagnosed? It can be diagnosed by four methods. One is ultrasound method. Ultrasound is the standard method of diagnosing the presence of deep vein thrombosis. Ultrasound, there is one machine, they just check our, for example, if we have blood clot in our leg, they just check, they just scan, like a scanner, they use some instrument to check in our leg. It will show the clot by producing some sounds in that particular part. The second test is, or the second diagnosis method is blood test. What happens in the blood if there is a blood clot means the level of D-dimer will be increased in the blood level. Then third diagnostic method is venography. What happened, what they will do in this venography means a dye is injected into a large vein in your foot or ankle. An X-ray creates an image of the veins in your leg and feet to look for clot. This dye will be helpful in observing the clot. However, less invasive methods of diagnosis such as ultrasound is used as a confirmed method for diagnosing the thrombosis. Finally, we can use the diagnostic method as CT or MRI scan. Either they can provide visual images and might show if you have a clot. Sometimes these scans performed for other reasons to reveal a clot. So there are four diagnostic methods for thrombosis. One is ultrasound, second one is blood test, third one is venography, and the fourth one is CT or MRI scan. Next, treatment for thrombosis. So we have studied about thrombosis, what is meant by thrombosis, causes, symptoms, diagnostic method, and the last one is treatment. How can we treat this thrombosis? Is it curable one? Yes, it is a curable one. We can treat by applying blood thinners like anticoagulants. Even you may hear about iodex. We are applying iodex in the particular clot parts. Here I have written some examples like heparin, enoxaparin, deltaparin are injected under the skin to remove that blood clots. Next one, clot busters. There are some sprays for bursting the clots. Third one, filters. If we apply on the skin, if we apply that filter on the skin, it does not affect other parts. It directly go and treat the clots, blood clot. And the last one is compression stocking. See, there may be some stockings are available in the medical shop. We just buy it and we can wear in the leg. The doctors may prescribe to use for at least 1 week or 2 weeks. If we use that stockings continuously during the night time, they will prescribe the times also, how many hours we want to wear that stockings. By that prescription, we can cure or we can treat this thrombosis. So there are four methods to treat this thrombosis. Next one is shock. Life-threatening condition that occurs when the body is not getting enough blood flow. So by this definition, we can understand the relation between hemodynamics, thrombosis, shock. Hemodynamics, if there is a change in blood flow, it may result in some disorders, is it? Then thrombosis, if there is a clot in blood or in blood vessel, then it results in thrombosis. Shock, what happened? If there is not enough blood flow in our body, it results in shock. So, hemodynamic, thrombosis, and the shock are interrelated. Lack of blood flow means the cells and organs do not get enough oxygen and nutrients to function properly. I hope you remember this point related with the hemodynamics. What I said, why this blood flow is happening? This blood flow helps for transporting the nutrients, oxygen, carbon dioxide to regulate pH, osmotic pressure, everything in our body. So, if there is a disorder in blood flow, what happens? There is the decrease in transporting these nutrients, oxygen, so that the function of our circulatory system may get affected. Shock needs immediate treatment and can get to us very rapidly. Next, there are 5 types of shock. One is cardiogenic shock. How this cardiogenic shock happens means due to heart problems, like if we get heart attack or heart failure. This cardiogenic, there is a chance for getting cardiogenic shock. Second one is hypovolemic shock. It happens due to too little blood volume. Blood content is reduced means there is a possibility to occur hypovolemic shock. Then anaphylactic shock caused by allergic reaction. In our body, if there are some medicines, it may cause allergies in our body. So during some other health issues, because of some other reasons, there is an allergy in our body, means it also results in anaphylactic shock. Next one is septic shock due to infections, like if suppose someone may have tuberculosis, TB, so it is caused by microorganism, mycobacterium tuberculosis. Because of that microorganism, our body gets infected. It results in septic shock. Then neurogenic shock caused by damage to the nervous system. So there are totally 5 types of shock. Next, what all are the symptoms and causes for shock? Symptoms are, it includes low blood pressure, rapid shallow breathing, cold and clammy skin. Without any cold wind, we may feel suddenly cold and our skin may become clammy, tight. Why? It is because of maybe shock. Then rapid weak pulse, dizziness, fainting, weakness, confusion, chest pain. These all are the symptoms of shock. What all are the causes of this shock? Number 1 is heart attack or heart failure, injury or rupture of blood vessel, dehydration. You see, someone will work in agricultural field throughout the day. What happened? He's exposing his body to the sun, overheat. It may result in dehydration in his body. Finally, it results in shock. Then infection, severe allergic reaction, burn, persistent vomiting and diarrhea. So here we have listed the symptoms and causes of shock. Next, diagnosis. How can we diagnose this shock? X-rays, blood test and EKG. EKG is a special diagnostic method to observe shock. They simply scan, in this procedure, they simply scan our body to identify what is the reason to cause this shock. Then treatment. What are the treatment for shock? I already told that there are 5 types of shock. For septic shock, antibiotics are used to treat. Anaphylactic shock, epinephrine steroid medication. Cardiogenic shock may treated by surgery or even heart transplant. I hope you heard about the heart transplantation nowadays. We are very advanced era. There are many uncurable diseases are cured nowadays. Why? Because of very advanced technologies are available to treat the diseases. Even in the last class itself, I told that they are discovering medicine for this COVID-19 very fast. The steps were going very fast. Then last one is neurogenic shock. Neurogenic shock is difficult to treat. Anyway, there are some prescriptions to treat this neurogenic shock. Next. Okay. So in today's class, we have learned about what is meant by healing, regeneration, and repair. This healing can be done by regeneration and repair. I hope you remember what is meant by regeneration and repair. Then we have studied the disorders like hemodynamics about blood flow, then thrombosis about blood clot, and shock. Shock means disorder in blood flow. So these all are the topics we have studied, and we have studied what all are the causes, what all are the symptoms, what all are the diagnostic methods, and how can we treat those disorders. I hope you will be understand well. Thank you. Thank you, guys.
Now, if you have any doubt, you can ask madam. Now you are free to speak.
If you have any questions, you just unmute your audio and you can come in line.
So, this is Margaret, and I wanted to ask, since neurological shock is difficult to treat, what medicine can you give to your patient suffering from this kind of a shock?
Why they are saying this neurological, neurogenic shock is difficult to treat? You see, if it will damage the particular organs or parts, so it is very difficult to treat. But anyway, the doctors will go for the treatment like other shock. I mean, like antibiotics, surgery. Even surgery is the best way to treat this neurogenic shock. The doctors are saying. But anyway, there is note that neurogenic shock is difficult to treat by doctors.
Thank you.
Thank you.
If you have any question. Okay, I think no one is having question. So shall we close the session, madam? Madam.
Okay, sir. Thank you, guys. Thank you for listening. Let me continue the next. Yes,
can you please send us the slides for the same notes?
No.
Yeah, you can. Yeah, you can use the same slides for notes.
Video and slides will be followed shortly.
Okay, thank you.
Okay. Thank you, guys. Thank you for listening. Let us meet in the next session with the next unit. Thank you, sir.
Thank you, madam.
Okay.